Right, here in Korea, starting on this Thursday, those who are fully inoculated overseas have access to COVID-19 vaccination incentives. For more on this, I have our Choi Won-Jong here in the studio. Won-Jong, welcome.
Good afternoon.
Right, so like I said, starting today, even those who are vaccinated outside of Korea can indulge in incentives such as social gatherings and more.
Right, that is absolutely correct. A lot of people who've gotten their COVID-19 vaccines outside of Korea have found it difficult to prove their inoculation status when visiting coffee shops and restaurants, meaning they weren't eligible for vaccine incentives. And kicking off Thursday, though, those who come to Korea with the quarantine exemption document can prove their inoculation status, meaning they're now able to get the benefits of being vaccinated. They can register their information online using apps like Koov at the local health center. Now, this will help travelers inoculate abroad and U.S. soldiers stationed in Korea prove their vaccination status as well. And however, it only applies to vaccines that are approved by the WHO.
Right, and of course those vaccines will include Pfizer, Moderna, AstraZeneca and so forth.
Right.
Right now, Won-Jong, I hear a new side effect has been added to the list of health conditions following COVID-19 vaccination. Can you tell us more?
Yes, it's called the menstrual disorder. Actually, there used to be only 7 items on the list of COVID vaccine side effects. However, Korea's health authorities are trying to cover a wider range of symptoms now to strengthen the monitoring system for COVID-19 vaccination. Take a look at this screen up on your screen right now. That we have a fever, a pain, swelling and redness, vomiting, headache, fatigue, allergic reaction, and the now menstrual disorder has been included.
Right, I see. Moving forward, Won-Jong, what's the latest on offering enhanced protection against COVID-19 here in the country?
Well, Sonny, as you know, the health authorities have started taking the vaccine reservations for booster shots for groups who are mostly exposed to higher risk of catching COVID-19.
Right, and just for clarity, when exactly did the reservation start, Won-Jong?
Yeah, just briefly, the bookings for booster shot vaccinations has started since Tuesday. For those underlying conditions, it starts in October 18th, and the actual vaccination will kick off in October 25th.
Right, so that's later this year then. I mean, this month that would
be.
That is. So, Won-Jong, who is eligible for booster shots?
Right, so since October 5th, those in their 60s and most medical workers has been able to apply for their booster jab. They're getting the mRNA vaccine from either Pfizer or Moderna. To clarify this a little bit more, is if you previously got the Pfizer vaccine for all doses, you will get another Pfizer shot. And if you had 2 doses of Moderna shots, your extra shot will be from the Moderna. However, if you're administered with the AstraZeneca vaccine, you'll still receive either Pfizer or Moderna.
Right, so once again, just to clarify that, my husband got the AstraZeneca first and then the Pfizer for his second dose. What will his third dose be then?
So that's actually a lot of questions, a lot of people question about it because they will still get either Pfizer or Moderna's vaccine, but the booster shot for Janssen has not been decided yet, so that's we'll see that's going to happen next. But I would like to point out the research says the effectiveness of Pfizer booster shot is 11 times higher for preventing the infections and 19 times higher for preventing severe cases compared to those who didn't have the extra shot.
I see. Well, that is comforting to know. All right, Won-Jong, don't go anywhere. Stay with us because I have Soa now for a closer look at the latest on the local vaccination efforts targeting young teenagers. Now, Soa, after some deliberation, I hear authorities have decided to disclose details on the vaccination registration rate among these young teenagers.
Right. We touched upon this a little bit yesterday, but they have now released the figures. So according to the government's press release on Wednesday afternoon, over 20% of teenagers aged 16 and 17, which is those born between 2004 and 2005, have made their advance reservations to get vaccinated for COVID-19. This in a span of just 4 hours from 8 p.m. Tuesday when registrations opened until midnight. The figure may be translated as an active participation given that authorities are permitting but not strongly pushing for inoculations for teenagers, citing a low chance of children and teens to develop severe or critical COVID-19 symptoms if infected with the virus. Now, those aged 16 and 17 have until the 29th to make their bookings before getting their first out of 2 Pfizer doses starting on the 18th this month. And that's the date when those aged 12 to 15 start making their reservations.
Right, and I hear that expectations are quite high, Soa, that the COVID-19 vaccination rate among these young teenagers will surpass that of the seasonal flu vaccine.
Right, Sunny. So forecasts are being made after we saw that roughly 20% of reservation rate among those aged 16 and 17 on day one. Now, if we compare the figure to how many people actually got their flu shots from 2020 to 2021 during the vaccination period for the seasonal flu shot program, 59.5% of teenagers aged 13 to 18 have gotten flu shots. So maybe the first 20% that we just saw were those who were more enthusiastic in making that reservation. So the process may slow down, but there are expectations that there could be a high percentage of teens getting that vaccination. And, the interest in teenage vaccination may also have grown as we have been seeing more and more infections at schools or other educational facilities after the second semester of the year kicked off. And in fact, just recently, there were new cluster infections at an elementary school in the southeastern port city of Busan. Also in Gyeongsangbuk-do province, there was an cluster infection linked to a high school. And again, in Gangwon-do province's Wonju, there was also a cluster infection at a high school. Those were all news that came out just this Thursday. And there are also more at cram schools and many other educational facilities.
Right. And like you said, these cases are perhaps encouraging younger people to get vaccinated. Speaking of the seasonal flu that you mentioned earlier on, the seasonal flu shots, so how is that annual campaign coming along?
Well, Sunny, as this is the first autumn season for Korea with COVID-19 vaccinations under progress, annual vaccinations for the seasonal flu are progressing simultaneously. In mid-September, the government's free flu shot program has begun for pregnant women, babies, and children, while seniors aged 65 and above will also soon be subject to these free flu shots. Now, registration for seniors aged 75 and above has started earlier this week and will kick off for younger seniors in the coming days. They will get vaccinated consecutively between October 12th and November 30th. Babies from 6 months and children aged up to 8, as well as pregnant women, require 2 doses, others just 1. Those who were not able to make early registrations can get vaccinated throughout early months of next year. Authorities are also calling on active cooperation in getting flu shots, especially amid the pandemic, as they can also help in diminishing confusion with COVID-19 symptoms.
Right now, so this is something we'll be touching upon with our panel of experts later on the program. But authorities have also said that receiving the flu shot and the COVID-19 vaccine at the same time should not be a problem.
Yes, it's not a problem, but I believe that some experts have been recommending to not get them on the same day or, back to back, but maybe have a slight term in between.
Right. Meanwhile, turning back to booster shots, Won-Jong, what can you tell us about the launch of booster shots in other countries, including the US, for instance?
So yes, you point out very well. In the U.S., you remember the President Joe Biden had a booster shot last week. I believe it was September 27, and the medical workers and the teachers are also urged to get the shot after all. But what's really interesting is that, because I found out from the local news media there, is that the confusion among people are really big there, because some saying that some experts and medical workers saying that this needs to be stopped right away, but then others don't think they need the booster shot because they were suffering so much about the after getting the vaccination, because they're getting so much side effects. For instance, after second dose from the Pfizer, the headaches or maybe the fevers are so much after all. So that's why they are saying that I don't need any more booster shot. But then, so I think the lack of information about how effective the booster shot is and why actually they need one is really lacking in the United States, I believe.
Now, so then, aside from the US, you mentioned the UAE earlier on when you were talking about your general overview of the COVID-19 situation across the globe. And you spoke about the country having declared that the fight against COVID-19 has neared an end because their vaccination rates are quite high.
Exactly.
Are they thinking about exploring the option of booster shots. Do you know?
Yes, I believe so, and especially because the UAE, in fact, had a vaccination rate of over 90%, if I remember correct. And just to clarify, in my earlier report, I mentioned that the 7 Emirates of the UAE had fewer than 200 new cases this month, and that's the lowest figure since August last year. So that has really declined a lot. And the UAE, in fact, recently just authorized the Russia-developed one-shot Sputnik Light vaccine as a booster shot, just having authorized the shot alone, the vaccine, the product alone, and also for the booster shot. Meanwhile, we are seeing that countries that have the highest vaccination rates also are early in their booster shot program. And one of the countries that we talked a lot about before was Israel, of course. And Israel now just recently on Sunday said that it will actually make booster shots mandatory as well for certain people, and that would be also the first for Israel across the world.
Right, and before we go, then Won-Jong, once again, returning to your talk about incentives for those fully vaccinated, including those from abroad, could you tell us a bit more about the incentives currently available? Because in the absence of vaccine passes that someone mentioned yesterday, we don't restrict entrance to those only vaccinated at the moment. So what are the incentives that they can enjoy?
That is correct, and I also want to talk about the level 4 in the capital, the Greater Seoul area. I think that one of the biggest things that we want to talk about here is a social gathering. For instance, before, so 6 people are allowed, but before 6, with 6 people with the 2 fully vaccinated, but after 6 p.m. still 6 people are allowed, but with the 4 fully vaccinated. So that's the biggest thing here. And another thing I want to point out is that if you're fully vaccinated and you had a contact with, let's say you have a COVID-19, catch COVID-19, and then I'm fully vaccinated and we had a medical contact, and after all, and then I am actually exempt from the isolation. So that's another biggest incentives that I want to talk about.
Right, well, that is good to know. All right, Won-Jong, thank you very much for that. And Soa, thank you for being with us today.
My pleasure.